Hi everybody, Jackie here with Dr. Bilski of Bilski Family Dentistry. How are you doing today?
Good afternoon.
Good afternoon. So today we're gonna do something a little different. I have a question about a friend of mine. They have a crown on their tooth and it's an old crown and it's causing them really bad problems. They kind of thought this was solved by the crown, now they're having issues and they're really worried, do they need to have their tooth pulled? They don't want to do that. So do they need to have it pulled?
So there's a couple questions within there. That's why I love these questions. The first question is, I have an old crown and my doctor is telling me I need to have a new one. And the reason why would be probably because there's new evidence of new decay forming around the gum maybe or in a spot that you can't really clean it out properly, and it would be kind of like a half-done job. So the recommendation is remove the crown. So when a patient hears remove the crown, they think, oh no, not my tooth.
Yeah.
So the next question is, do I have to have my tooth pulled?
Right.
No, it doesn't mean that.
Do I need an implant? Do I need to do this whole nine?
Yeah, like the whole thing.
Is the crown not working? Do I have to take it to that next level and get an implant?
Why did I get this crown?
Yeah.
So we're usually talking about crowns that have lasted 15, 20, maybe 30 years, depending on how long you've been practicing and how long your patient has been with you. And in many cases, it's just, we call it popping the crown, just taking the crown off, looking down in the tooth, clean it out, and then making a new tooth. And we talked previously.
It's a new crown.
Yeah, it's a new crown. So we are removing. That's why I say pop the crown, not remove the crown. It really is critical with a lot of patients. So, no, you don't have to have your tooth pulled, or this particular person does not have to have the tooth pulled. It's usually a replacement. It may get a little dicey. Do you need a root canal and a post, then the crown? We don't know until we clean that up.
And take a look.
Unless clearly the person was having pain. So these are the questions that we get. Well, I don't have any pain and I can kind of taste something bad and I see it. My doc says I have a cavity. I need a new crown. Yeah, I'm going to get it. And then they hear the remove part and like, oh no.
I don't want to do that.
Yeah, and there was nothing ever even brought up by that doctor to mention having a tooth removed. It's just pop the crown.
So if he's not having pain and but it's causing him issues, it could be as simple as popping that crown off, cleaning it up, and then just getting a new crown, which you can make right in your office with the
CEREC.
CEREC. I wanted to say, I was going to mispronounce it. So the CEREC machine, it's like, 2 hours to get a new crown done?
Sometimes 2 hours, sometimes 90 minutes.
Wow.
It depends on the patient, where the position of the tooth is, how many bathroom breaks the patient's making. But 2 hours is what we usually tell our patients. And we have a nice little coffee shop down the street, and actually walking distance, 2 doors down. They can pop in for a coffee while the crown's being made.
Wonderful.
And then they come back and they get their tooth and they go home.
And they get their tooth.
Yeah.
So it's a one day in and out. It's not as scary as he's thinking it is.
No, we always try to minimize, again, back to not messing with mom's schedule or any person that has a life who wants to spend time in my office 3 times when you can be done in 2 hours.
Absolutely. So, I'm definitely going to take this back to my friend, but for anybody out there who's experiencing a similar issue, you may not need to get your tooth pulled. You likely don't. Probably just going to be as simple as popping that off, cleaning it up, and getting a new one on there. So if you are having trouble with a crown of yours, then you need to give Dr. Bilski a call, come in for a consultation and assessment, find out what's wrong and the best solution for you. It's probably not as scary or as intense as you think it is.
It is not.
So give them a call at 216-524-4410 or visit them online at bilskidds.com. You can also drop by their office right off Rockside Road in Independence, maybe stop at that coffee shop down the way and schedule your appointment with their staff. Thank you so much, Dr. Bilski, for talking to us today.
It's always a pleasure.